Today marks 88 days since the coronavirus was first confirmed in Illinois, and African Americans now represent 57% of all COVID-19 deaths in Chicago. In just the last 2 weeks, the number of black victims has tripled.
CBS 2 investigator Dorothy Tucker first identified 5 hot spots using maps we created. Now she's digging deeper into that data and found in the neighborhoods where the victims lived, many have essential jobs that increase their chances of being exposed to the deadly virus.
Look no further than these blue points. These are people who died of coronavirus. Most of them live in Chicago's black communities, the hot spots for COVID-19 deaths. When we first took a look 2 weeks ago, 5 neighborhoods had the worst deaths: South Shore, Inglewood, Auburn Gresham, Austin, and Chatham. It was bad then, it is worse now. Inglewood is leading the way. The number of deaths has jumped from 6 to 23 as of last Friday. South Shore is almost as bad, 7 deaths last week, 22 by the weekend. Auburn, Gresham, Chatham, and Austin neighborhoods, all those we identified as hotspots, have also seen increases. A common thread among those who died: where they work.
When we consider the types of positions that many Black Americans hold, many of them are on the front lines in essential roles related to food delivery, grocery store work, transportation services.
The data we pulled reflects the reality. In Austin, where 19 African Americans died, nearly 11% of those employed work in transportation. That's nearly 3,500 people. In Inglewood, about 12% of those employed, or just over 2,000 people, also work transportation jobs. Another 1,200 work in food preparation. Dr. Carnathan uses the example of a 30-year-old grocery store worker.
He or she does not have symptoms. He or she is not coughing and sneezing, but they're talking, they're interacting. They are providing care for younger children. They are providing care for elders. When that happens, the virus spreads.
Another popular job in those communities are people who work in the healthcare industry, either as janitors or perhaps kitchen workers, people who have to go to work, they can't stay home, so they are exposed. Erica, Brad?
Well, you mentioned Austin, Chatham, and Auburn Gresham. Dorothy, how much did the numbers increase in those communities?
Let me take a look at just the comparison. Auburn Gresham. 2 weeks ago, there were 6 African Americans who had died in that community. Today, there are 17. Chatham, 5 deaths. Today, there are 12. Austin, 5 a couple of weeks ago. Today, there are 19. Those numbers have more than tripled.
All right, Dorothy, thank you.